Thank you. So my name is Andreas Cleve, and I am the CEO of Corti. We're a European artificial intelligence company building digital solutions for healthcare. Corti was founded in 2016 on the premise that we in healthcare have a desperate need for better tools. And although medicine and healthcare has seen dramatic changes over the last century, a lot of the tools that today are the most used tools we know are still from the time of Hippocrates all the way back in ancient Greece. And that is mind-blowing, right? So in so many of our lives, the tools change every 3 or 4 years. But us as technologists, as we started diving into the idea of building better tools for healthcare, we found a lot of the tools there today are actually quite old. The oldest of all tools we found in healthcare was patients talking to a doctor, what we call a patient consultation. So you sitting in front of your doctor, talking to them, and the doctor will here leverage both intellectual skills, so all of their expert education, and of course their emotional intelligence in understanding the patient, asking questions, making sure they get all the quality out of it. And what we know is that there's a bit of science in that, of course, a lot of science in that, and a little bit of art, right? So understanding the human being. So we thought that this is actually really interesting. So does patient consultations look like? If you look at an average medical doctor, they will have something like 150,000 patient consultations during their career. And to set that into perspective, that's 700 Boeing 747 planes filled with patients. And that's dramatic, right? Because none of us would enter a plane without a co-pilot. But in this case, every one of these 700 planes is filled with patients that only was sitting with a single doctor. And as we're all patients as Corti as well, our thinking was, okay, how can we help? So we started diving into if we wanted to build something for this oldest tool in healthcare, these patient consultations, what was the biggest problem? And one of the things we found was that misdiagnosis, so just the fact that patients aren't giving the right diagnosis or they're not giving an adequate diagnosis is actually one of the biggest killers in the US behind cancer and heart diseases. So ultimately, we thought this seemed like a very, very important problem and something that we might be able to help. And diving into the data, we actually found that 88% of data, and this is according to a study built by the Mayo Clinic, who interface their doctor when they get a patient consultation, will experience that their information or the triaging outcome the doctor had or the diagnosis was so incomplete that if another doctor had heard what has been said, it would have been radically changed. So we thought, okay, if we need to upgrade patient consultations, let's build on the idea of having an automated second opinion. So what we did was that we started to look at, okay, all of these consultations, what would we do to give a second opinion? What we saw was that there was a desperate lack of overview, there was a desperate lack of feedback, and there was a desperate lack of creating more certainty within it. So how could we marry this arts part and the science part? So what we did was we built Corti. Corti is a digital concierge app, so like a robot assistant. It's built like Siri and Alexa, so it's built for voice and video. And what it can do is can listen for anything that is said and shared by a patient and try to understand that and give cues to a doctor or medical professional on if what is said right now sounds like something it's heard before and whether or not that's potentially critical. So to do that, we had to build an AI, an artificial intelligence that is able to understand free-flowing conversation. So a lot of us who have speech technology in our homes is used to giving commands. So turn up Spotify or whatever that command might be, but it's a command. It's a one person talking to a machine. Our artificial intelligence would be listening to patient consultations. So it would listen to doctors and patients. So it's a free-flowing conversation, and we had to make sure that we understood that in real time, never mind if this conversation was on voice, video, or text. So we had first to find one of these consultations where we could start helping. And the first one we found where we could actually measure if we were helpful was in emergency calls. So across the globe, we have several numbers you can call when you're in a country to get help if something critical happens. Here in Copenhagen, where I call from, it's 112. In a lot of the places where we work in the United States, it's 911. The interesting thing about these emergency departments is that if you look at the technology advancement at an emergency department, so the people who pick up the 911 call the worst day of our lives, they will actually be sitting in a dispatch center that is based on very old technology. So what you see here is pictures up from the 70s up until now. And the interesting thing to notice is that during this period, all of us as patients, we experienced the personal computer. We experienced the cell phone. We experienced some of the most dramatic changes in technology ever in the history of humankind. But this technology that actually still is leveraged here at these dispatch centers is of course following along, but it's also changing due to the patient's IT landscape changing quite a lot. So if we were to help them, we were in a situation where these dispatch centers were in a changing environment where patients were expecting more and more and had better and better tools, and they had more and more calls and they were getting harder. So when we asked them, hey, do you want a digital AI concierge service that maybe could help you triage emergency calls better, they said, we don't believe you can do it. But we think this could potentially be interesting, so we will test it for you. So let's see if your artificial intelligence can help us save people from cardiac arrest. So cardiac arrest is one of the biggest killers in the world. Approximately 4 million people die each year due to cardiac arrest. And the hard part is that from the moment the cardiac arrest occurs, you roughly have 10 minutes until the survival rate is close to or at 0. So roughly 10% survival rate will drop every minute, which makes this very important for an emergency department. When we started calling around, we thought this was like a Danish problem, but actually the biggest cities in the world, they have survival rates on cardiac arrest that are below 10%. So what we did was we took our speech recognition platform and we took hundreds of thousands of calls about anything. It could be about nausea, it could be about strokes, it could be about birth complications. And then we trained the AI in understanding what's going on in these emergency calls. This meant building an artificial intelligence with multiple layers, able to understand all the granularities of the audio. So not just the speech, but also the sounds, the voice, the coughing, or whatever would be going on in these consultations and emergency calls. So when the AI was tested, we had to prove it worked. So the emergency department in Copenhagen saw some really promising results and decided to test our artificial intelligence on more than 33,000 patients calling in during a 911 call here in Copenhagen. What it proved was that if the AI was listening in simultaneously as the call taker, the medical call taker at the emergency department, if they worked together, the AI could help them detect cardiac arrest 50% of the times where it wasn't detected. So we could remove a lot of errors. All of a sudden, the human who without the artificial intelligence was already extremely skilled could be augmented to be a lot better. And that was because the AI had heard all of these calls. And as we know, computers don't forget that. Computers are not empathic and can't do a lot of things that we find very banal, but a computer is amazing at remembering. What was even more interesting when we started testing this across the world, and we took this to Australia, we took this to rest of Europe, we took this to America, is that what you see here is a bit of a technical curve that on the x-axis will show you the amount of errors, and on the y-axis will show you the amount of correct guesses on cardiac arrest. And as you can see over time, as it moves through the graph, more and more of these cases are known by the AI. So it gets smarter, it hears more and more and more. And as it hears more, we can actually prove that it gets smarter, it gets better at detecting critical cardiac arrest on an emergency call by just listening to more and more calls. This, of course, builds something quite interesting of a premise, right? Because if we can add more calls, then we can come up with better suggestions for the user. The user would then use the technology better to verify that we actually build a good algorithm, and we could then keep training it to make it better, which in turn will make a better product, which in turn will have more users coming. So as you can see, this kind of product, given that we have clinical use of it and we actually have clinical proof it works, all of a sudden creates this effect where it will grow and even help the professionals do more and more. So today we started, today, and this is from 16, you can see a small white lamp in the right bottom of the screen. That is actually our device standing live in the emergency room here in Copenhagen, listening to more than 1 million calls in Copenhagen a year, where it helps now with a lot more than cardiac arrest, also with 40 other pathologies or problem types. But it's loved by the dispatchers and a big part of what they're doing today. The technology has since been rolled out across the globe, sadly not in Korea yet, but we're still hoping soon to be able to come to you guys. And our strategy was that we need to make sure that the best in the world are using it, to validate it, to train it, to optimize it. But again, we then came to all these great organizations across the world, and what we saw was happening was that the medical landscape was changing. So as it's been known for a long time in Korea, telehealth and digital consultations is only becoming a bigger part of the healthcare sector and the offerings that patients want in the future. So I as patients, we're used to across everything else, from our banking setups to our personal applications, to get exactly what we want when we want it. We're used to getting extremely fast results. We're used to using self-service solutions, mobile platforms, web platforms that are personalized and intent-based and consistent in quality. So we met all these great organizations, but they were pushed to do video engagements and text engagements and new technology and meeting the patients where the patients were, which of course to us is an important challenge, since we cannot underestimate the needs of the patient. So we started building these formats, and all of a sudden we had a new reality scaling this company out of Europe to the rest of the world, that COVID-19 started happening. So as I just said, we started in emergency calls, and you can imagine the moment COVID-19 started happening, a lot of emergency departments across the world got very, very busy. Because not only did people die from what they used to die from and call about what they used to call about, from strokes to cardiac arrest, now they also called about COVID-19. This was now happening in video consultations. People were using chatbots. People were using remote care applications and personal health applications and hardware. And COVID just accelerated this to a point where at the end of the summer, 59% of patients were likely to use these digital services and much more than they were before. Even more interesting, 36% of US patients would actually switch to another doctor or physician to get access to these virtual care services, because during COVID-19, they got so used to using these services. Even more, US patient consultations, so the amount of times patients were meeting doctors digitally, went up from around 14% to 74%. Imagine how big a change this is in the healthcare sector, moving everything from physical meetings to digital encounters. So we asked, how can we help them even all these odds, because they were all facing these very, very hard triaging and diagnostic situations at hospitals, at doctors' offices, at emergency departments, where people were calling about COVID-19. So as we did back then, we had to look at the problem, and the problem with COVID, of course, is that it's a new thing. We aren't equipped for it. We didn't know it as this version, at least, of the coronavirus before. We weren't trained for it, and a lot of places, especially in the US, there weren't necessarily enough processes in place and enough equipment in place if there were to be a true breakout pandemic. So what we did for our US customers is that we, instead of training the AI in understanding cardiac arrest, we started training it in understanding COVID-19. So we fed it with a lot of consultations, hearing the audio and voice and video about patients talking about what sounded like COVID-19. And our US research partners then went to the hospitals and fetched all the patient journals. So now we could have on one side all the people calling about COVID, and then the truth about whether they had it or not. That meant we could now train the AI on what we call ground truth labels, which in turn let us build a new group of tools specifically for COVID-19. This means that an emergency department using Corti can now offer AI-based chatbots and self-assessment services that actually knows what COVID-19 sounds like. This means that we can build it into call queues at doctor's offices where you're waiting to get your call picked up. This means that we can support the nurse, the doctor, the call taker when they sit there and have to make a hard decision on what to do with this patient that might have COVID, and the AI can do automatic quality assurance on it, which all of a sudden changes the narrative, because healthcare needs to go from reactive to proactive. And for us in Corti, we're almost 60 people, and we're 60 patients. And we want to be treated by a doctor and a nurse, the best of them preferably, but we want them to have the best tools. But this scenario with COVID proved that we could actually take even new risks, new pandemics, and turn it into models that could then support our staff, our professionals, our healthcare heroes in being in front of the curve instead of lagging after it. So today, Corti is not only used for detecting cardiac arrest and cardiac diseases, we're also used for a host of other things, among them COVID-19. And we're used directly with patients in self-assessment tools. We're used to support decisions at practitioners' offices, at emergency departments, and we help healthcare organizations monitor patients at home, report outcomes, and track development, which we're extremely proud of. And looking back at all that, that ended up COVID-19, where we started working primarily with emergency departments all up until now, where we work with a host of different healthcare services, trying to scale this AI company out of Denmark, out of Europe. We had some foundational learnings that we were lucky in a case of crisis like we've seen with COVID to have built the entire AI technology ourselves. So Corti does not leverage third-party proprietary data, only open source, of course, and that made us lucky enough that we could actually go and refocus our energy on supporting the global healthcare community during this COVID crisis. What we then next see that I think is an important learning building AI for healthcare is that there is a vast difference between health, what you know from your mobile application or your smartwatch, so privatized personal health services, and healthcare. Personal health services can be adaptive, they can be fun, they can be non-clinically result-based, but healthcare needs to be what we trust on the worst days of our life. And supporting healthcare is extremely hard for an artificial intelligence company, and let alone for a startup, which we will only try to live up to going forward in the future, and only can emphasize for people trying to leverage AI in healthcare. Second push was we saw that Amazon and big health tech is actually being invaded by big tech, and we keep telling everybody in healthcare that wants to be a service provider, Amazon or whoever it will be coming. Furthermore, we saw patients during the COVID crisis, they want better and better outcomes. And although we keep discussing data ethics and data security, we were in a crisis here where something was more important, and that was personal safety. And to balance safety with ethics and data protection is one of the biggest challenges for an AI company today working in healthcare. And we look forward to keep working with healthcare providers and patients across the world to get smarter at how we can support them better and balance that need for extremely high data security with providing the services needed for everyone on Earth to have access to expert healthcare. So this was my introduction to Corti. You're all more than welcome to reach out. My email is there, ac@corti.ai. I'm also on Twitter, Andreas Cleve, and you can find Corti on any major platform. Thank you so much.